want to thank everyone for joining us tonight. I know this was pretty much a quick blast announcement out. My name is Tia Tomlin, and I'm the co-founder of My Style Matters. We are a nonprofit organization based out of Atlanta, Georgia, that provides supportive services to cancer patients as well as caregivers, and we help to educate the community on cancer and cancer prevention. And I want to introduce my co-host, and that is Julia. Julia, if you want to just say a little bit about your organization. She's the co-founder of GRASS.
Yeah, so thank you, Tia, for reaching out and for doing this together. It's a pleasure to be here with these amazing doctors who agreed right away when we asked them if they'd join us on this call. We're just so lucky. Like, they were the top of the top that we were going to ask, and they said yes right away. So GRASS is a new organization that brings together patients and clinicians and scientists to learn from each other so we can advance cancer research faster. And we really highlight the fact that patients are experts in living with cancer, just like clinicians are experts in treating patients with cancers, and researchers are experts in the biology of cancer. We have a lot to add to the table, so it's important to add patients to discussions. And both of these doctors on this call are the perfect example of doctors that want to collaborate with patients and that reach out to patients for their perspective and learn from us just as much as we learn from them. So thank you both for being here.
Absolutely. Thank you so much. So I want to take the time to introduce our physicians that are with us tonight. They're going to be speaking. Dr. Neelima Denduluri, she's a medical oncologist at Virginia Center Cancer Specialist. She received her medical degree from Louisiana State University School of Medicine in Shreveport. And has, please, if you guys can put your phones on mute by pressing *6. Thank you. Dr. Denduluri has consistently been named as a top doctor in Northern Virginia Magazine and Washingtonian Magazine. And she's been featured in both local and national media for her expertise in breast cancer. I'd like to also introduce Dr. Narjust Duma. She is an assistant professor and thoracic oncologist at the UW Carborn Cancer Center. She's committed to research and advocacy in diversity and inclusion. In 2018, she was recognized as the Resident of the Year by the National Hispanic Medical Association. Her passion for caring for women with lung cancer and studying the unique challenges that they face. I'd like to present to you our two oncologists. So thank you so much, ladies, for joining us. So what I want to start off with is we actually asked patients, we reached out to patients and we asked them to provide to us their questions that they have around cancer and COVID-19. And so what we want to do tonight is actually share those questions with you so that we can get those questions answered that a lot of the patients are actually having. So I'll start off with our first question. So Dr. Denduluri, what is the risk factor for breast cancer patients during and after each stage of treatment? This particular patient is taking AstraZeneca, and she wanted to know, does this or other AIs put us at risk?
First of all, Julia and Tia, thank you so much for organizing this, because I know that we have a lot of concerns about COVID-19, and we're all learning as we go along. And I know that Dr. Duma is equally and I can't say thrilled because we're not thrilled about COVID-19, but we're both happy to help in any way. So thank you so much for having us, and thank you both for leading such great advocacy efforts, because that's the main reason that we've made such advances in cancer care. So thank you. So regarding breast cancer care, the most dangerous time, I would say, for someone is going through therapy with chemotherapy, which does decrease the immune system. And that's why the social distancing, the washing of the hands, the wiping down surfaces, and also making sure that family members and friends or caregivers respect that so that we can make sure to decrease the risk of infections and the risk of transmission. Regarding the aromatase inhibitor question, tamoxifen and aromatase inhibitors, they target estrogen and progesterone in our bodies, and those drugs are not cytotoxic chemotherapy, and they do not decrease our immunity. Again, despite that, we should all be careful, but especially with the aromatase inhibitors and tamoxifen, or something we call GnRH agonists, which, when given monthly, can put our ovaries to sleep. All of those drugs do not cause immunosuppression.
Awesome. Thank you so much. The second question is also for you. I have 2 MRIs and doctor appointments coming up in the next 2 weeks. Is there a risk of me catching the coronavirus if I go? Could they shut down the clinics and doctor offices and cancel our appointments?
So what we as an oncology community are trying to do is try to limit anyone that can put off a non-urgent test or a non-urgent visit. We're trying to have them put it off at least by 2 weeks to 4 weeks until we can mitigate what is going on, because we're hoping to decrease transmission. So if it's a non-urgent breast MRI that won't dictate care in the next 2 to 4 weeks, then I think it's very reasonable to put that off, as well as if it's not some kind of chemotherapy that you're scheduled to receive on a certain date. I think it's also reasonable, no matter what type of cancer you have, whether it's a routine chest CT or an MRI. And Dr. Duma, do you agree that if it's a routine visit, that it's okay to delay by 2 to 4 weeks at least?
So we are delaying the scans that are follow-up scans that can be delayed for 2 or 3 weeks because of the risk of exposure. So if you come to the clinic, that is just, through the doors, you have to go and sit down in the waiting room and wait, and there is just time about exposure. What we're doing for some of these patients is we delay the scans where we're having some telehealth visits, 15 to 30 minutes over the phone, because this time is full of anxiety and fear. So if we decide to propose the scans, sometimes if you need it, we just also connect. So if there are routine scans, they're being all postponed for now.
Yeah, if it's not urgent, I always tell people now, stay home. We've been calling our patients, and we've been saying, listen, that routine mammogram, it can wait 3 to 6 months. That routine doctor's visit, stay home, do not come in. And I think across the country, we're all trying to mobilize telehealth, telemedicine, and we're trying to make that a way that you can talk with your nurse practitioners and your physicians so that we can at least facilitate some advice over the telephone and especially video conferencing and things. But those are all initiatives that we're all working very hard. But non-urgent scans, I think it's very reasonable to stay home.
Yeah, thank you.
And I think having a conversation with your doctor is very important because, to determine what is urgent and what is not. If you're afraid that something's being postponed that shouldn't be, I think talking to your provider, you can both try to find the best way to do it.
Exactly, and that's why what a lot of us across the country are doing is looking at schedules beforehand and seeing who's scheduled week out. Or do they really need to come? Can we call them? And certainly looking at our schedules for tomorrow, day after, et cetera, and really personalizing who we can prolong visits, the interval between visits for.
Awesome. Thank you so much. Dr. Duma, what is the level of risk for NED survivors in comparison to those who are in treatment and people without cancer? I've been NED since June of 2019. Radiation has caused damage to my lung, and it's hard to breathe at times. Are our immune systems still compromised?
So there are different types of patients and different types of cancer and different ways of what a patient can be NED. So some patients may have no evidence of disease but still be in active treatment, and some patients may have no evidence of disease and have completed treatment. So I think that are two different groups, because if you have no evidence of disease and you are getting chemotherapy, your risk for the infection is higher because your immune system is being suppressed by chemotherapy. If you have complete all therapy, the risk is lower. I think patients that have lung damage due to radiation, they do not have higher risk of getting the infection, but they do have higher risk of getting complications from the infection. And we have learned that from the experience in Italy and Spain, in which patients with history of radiation have more risk of complications. So for any patient with chest radiation, social distancing is extremely important. Not because they're at higher risk, but there are higher probabilities of complications if you get the infection.
Yeah. Awesome. Thank you. The next question is, I have a rare form of cancer and I'm surviving with one lung. How will this affect me, and what extra measures can I take to protect myself?
Well, I think, the type of rare cancer, it would be hard to find out what kind of cancer and when they completed therapy. So having a pneumonectomy, it means that you have less lung reserve. And one of the challenges about the viruses is that they produce a lot of inflammation in the lung and decreases the capacity of the lung for you to be able to breathe and feel that you're not short of breath. So patients that have only one lung, as we just mentioned before, they're at higher risk for complications. So any history of lung disease, radiation, lung cancer, COPD, fibrosis of the lung, or a pneumonectomy, which when they remove one lung, should pursue ways to stay home, in ways in which they try to avoid going to the hospitals and clinics if possible, because that lung reserve is diminished. You only have one lung, and if there's a complication, it would be challenging to breathe.
Mm-hmm. This is another lung patient, and she said, lung cancer patient, and she says, I have a lumpectomy next week. My cancer is spreading, and the virus has me worried about the hospital and having only one visitor. It's a 4-hour drive, and I'm worried if the person working on me has a virus or not. I have a lot of concerns.
I think, the important communication between her and him and her surgeon to determine what is the goal of therapy. Some of the surgeries that are elective are being postponed because we understand the risk of bringing patients to the hospital. And I think I would recommend that person to communicate with the surgeon and the oncologist to determine what if I postpone the surgery for a few weeks, how much is going to affect my health, and where there is over benefit. Regarding one visitor, we're trying to protect the patient from people that may come and they have no symptoms. And we're also trying to protect the visitors from the environment in the hospital, which is most likely to have super spreaders, which is a word that people are using. That's the people that have no symptoms, but they are still spreading the infection. So it's a two-way street. We try to protect people from coming to the hospital and also the patients to get exposed to more family members. It is difficult. Getting a lung surgery requires long time. So I think communication and teamwork, it would be important here.
Definitely. Thank you. Dr. Denduluri, why is the CDC saying not to wear a mask? If someone coughs or sneezes near me, won't I be more protected wearing a mask? Should I be wearing gloves outside and in our homes?
I guess the thought is with the masks are that there are special masks that need to be provided, and we don't have enough masks to go around. Additionally, we need to make sure and save those, for example, for the EMT technicians or the fire truck, the EMT technicians, all of the ER physicians, who are really the first responders, the ER nurses, all of those providers that are first responders in terms of mask shortage. Additionally, the masks that we've used traditionally do not seem to be effective against protecting against COVID-19. So that's the primary reason that we're not suggesting that people wear masks. The other thing about wearing gloves, within our homes, we're hoping that everyone is sanitized and we're not going to transmit from our own desk to ourselves. So within the home, I think that having a glove isn't going to really decrease transmission. When we go out, I think it's important that whether we wear gloves or not, that we're washing our hands frequently, that we are using sanitizing wipes, and really touching as few things as possible. And I think that I'm really applauding all of the restaurants for takeout, all of the grocery stores that are really trying to work with the community to say, listen, we want to decrease transmission as much as you do. And I think it's really great that, for example, the grocery stores are allowing those that are most vulnerable, if they unfortunately have COVID-19 in terms of the side effects, what they're doing is come in at special hours, and they're having sanitizing wipes when we walk in the grocery store. They're having sanitizer. So I think that if you're using those techniques, I don't know that gloves would add anything additionally. Even if we wear gloves, we still need to wash our hands when we walk in our homes or when we are eating or whatever we're doing, we still need to wash our hands. Dr. Duma, do you have anything to add?
I think with the gloves, I agree with you. One of the challenges about wearing gloves is that people are less likely to wash their hands if they're wearing gloves. So then you would touch the surface and touch your face. And now we offer a kind of fake sense of safety to wear the gloves, but the infection will still happen. But when we have our hands, and I found it myself, is that when I have no gloves, I wash my hands way more times. So we don't have that fake sense of safety.
And so.
Dr. Denduluri, are you still there?
I am. Can you hear me?
Okay. Yeah, you went out for a second.
Oh.
Did you have a comment that you wanted to add?
No.
Okay, awesome. All right, the next question, and I guess either one of you could answer this one. What can we take to keep our immune systems up? I'm taking airborne and probiotic. Is that going to help boost my immune system? And I'll add to that, there was another question that came in about elderberry, since we're talking about supplements. And the question around elderberry was, will elderberry cause me to be at greater risk for coronavirus?
Well, I can go first about the airborne and the supplement. So there's no data that will protect against the infection. So all of this, what we're learning is what things that happened in China, 6 weeks ago, and things that happen in Italy right now and in Spain. So most of the things that we're talking is what we're learning from other experiences, and there is no study to prove that works. There has been no relationship between using the airborne, which airborne includes high-dose vitamin C, which is around 1,000 milligrams, and includes zinc. So there is no data that we prevent the infection. So we don't have a way to say, yes, do it, or yes, don't do it. So I don't know if Dr. Denduluri has anything besides that to add.
So some of you who've seen me in clinical joke that I say, eat the way your grandmother ate. And so I think that while these are all exciting potential options, we have no data that they really help us. What we know is some of these supplements may actually hurt us. So I always say that, eating like my grandmother ate with healthy foods that were primarily whole grains and things, and decreasing alcohol, all of that can boost our immunity. Just being healthy in general, but I don't know that any of these supplements, unfortunately, can help us. Hopefully, in the next 5, 10 plus years, we'll have more data on what does help and what doesn't help in terms of boosting immunity beyond a healthy lifestyle, washing our hands, avoiding people that cough on us. But right now, I'm not sure that any of these supplements will help with COVID-19.
Something that it helps besides the diet, which is extremely important, is also sleep. So if you're severely fatigued, if you're not sleeping, and it's hard to sleep in the current situation, like it's anxiety feeling is hard. So sleep has been related with less likely complications, not from this infection, but in general. So I think sleep has a lot of value that sometimes we may forget. So that may be more efficient than the vitamin C.
All right, here's another one, and either one of you can take this question. Being that there is no hand sanitizer or alcohol left in the stores, what can we use to sanitize our hands if we do not have access to soap and water?
So I did a little bit of research about some of these because I was very, very torn. It's like, I don't know. So I read a lot about it. So one of the recommendations that the CDC is having is that to go for a less popular brand, but you make sure that the brand of hand sanitizer is not a brand that has less than 60% alcohol. So it may not be Purell. You may be able to find these hand sanitizers that people don't like or something like that. Important to mention is that soap and water should not replace hand sanitizer should not replace soap and water. If the soap or water is a possibility, that should be the way to go. And we all know you have to sing a song for 20 seconds when you wash your hands. Happy Birthday is the most popular one right now, but there's a song for Selena Quintanilla also that you can sing.
Or the Alpha song.
Yeah, there's so many songs out there. The point is, I couldn't find any data anywhere that says that besides the high concentration alcohol or washing hands, there is anything else that have been shown to decrease the virus. Baby wipes do not have alcohol, so they cannot replace the hand sanitizer or the hand washing. And there's also some data out there that I found very troublesome, which is making a hand sanitizer with alcohol, with drinking alcohol. So there's I'm going to put the example of the vodka, which is the one that people are talking in media. So if you use vodka, that's 80% proof, which is only 40% alcohol. So it won't do the job because there's not enough alcohol. So even if you want to use, I don't know, vodka or rum, it's not enough to clean your hands.
Yeah.
So I don't have an answer, but I found a lot of things that don't work, which is baby wipes, vodka, and other things.
Okay.
The thing I found is that unfortunately it's not for the hands, but for surfaces, and it's actually on the CDC website, is to go ahead and do diluted household bleach solution. And the formula that they recommend is 1/3 cup bleach for 1 gallon of water, or 4 tablespoons of bleach, or 4 teaspoons of bleach, for 1 quart of water. So, that might be an option too, is if there's no hand sanitizer, to at least carry some of that to wear with a cloth in your bag, and that way you can at least use that to clean the surface.
And one thing is, for some of the women that are taking TKIs for lung cancer, the hands tend to get very dry. And that can happen for some of the lung cancer treatment, for one of the breast cancer treatments. So what they recommend is that you can wash your hands for 20 seconds, dry them up, and you can use a moisturizer after you dry them. So just try to prevent some of the peeling that will come with washing your hands so frequently if you're in those fields.
Awesome. Thank you. Here's another question. Can immunotherapy put me at greater risk for being diagnosed with coronavirus?
So the whole thing about immunotherapy is that we don't know. There is not a lot of data about patients with immunotherapy. Even the patients with cancer, the 18 patients with cancer that were published from China, most of them were not getting immunotherapy. What we know is that it will not increase the risk, but also we know that it will not protect you. So immunotherapy is a type of treatment that activates your immune system to attack the cancer, but that doesn't mean it will prevent you from the virus. So if you're getting immunotherapy, it doesn't mean you're not getting it. It also means that you're immunocompromised in a way because your immune system may be shifted to a different pathway and not be focused on attacking viruses. So it won't protect you. You are at risk if you're getting immunotherapy because you already have a cancer. So I would take the same measures that any other patient that will be getting chemotherapy.
And Dr. Duma, often we give the immunotherapy with cytotoxic chemotherapy as well, right? So
that's true. They usually come together.
That can also decrease our immunity.
All right, here's one more question. I had a lumpectomy 2 years ago and have COPD. Just had a PET scan, and I'm waiting on the results. I have shortness of breath when going up the stairs, but I've had it for a while. What are some of the signs I should look for coronavirus?
I think one of the challenges as a thoracic oncologist or a lung cancer doctor is that many of my patients have a baseline cough because of radiation, because of the cancer. So it tends to be very difficult. But what we know is unique to this virus is that the great majority of patients, we have a fever. So looking for a fever, because over 90% of patients, we have a fever, the ones that were in the hospital. And also acute worsening of the cough. If you have a chronic cough, but the cough is becoming more dry and more frequent, I think and you have other symptoms of respiratory infections, I think it's worth talking to your doctor. Not only because your immune system may be affected by the therapy, also because your lungs may have less reserve. So fever, many patients have a cough, but if the cough is worse, in the last few days, we are runny nose, with fatigue, and with muscle pain, that's something to look for. So we shouldn't all disregard a cough in patients with lung cancer.
And I always ask people, has the character of your cough changed, as Dr. Duma said, or has the character of your shortness of breath changed? Because I think that makes a difference too, is how different is it from your baseline?
Yeah. Thank you. Here's another question. I don't have cancer, but I'm taking chemo. Would I fall into the same category for risk as a cancer patient?
It depends on what type of chemotherapy, but generally chemotherapy, for example, low-dose chemotherapy is often used for rheumatoid arthritis or rheumatologic issues. So any type of therapy can decrease our immune system independent of whether you treat cancer or not.
Okay. Dr. Duma, did you want to add anything? Well,
I think, in general, I think chemotherapy, a doses used for cancer, we lower your immune system. Even if the patient has no cancer, we have less white cells, for example.
Okay. This is another question. I am working from home now, but what is going to happen when I go back to work? How do I tell my employer my concerns, being that I have a compromised immune system and have shared cubicle space?
I think that this is uncharted territory for us all. When patients do finish their chemotherapy, depending on what kind of work setting they're in, independent of the COVID-19 setting, we do tell people that they should have some flexibility to be able to decrease contact with others if it's close situations or if someone is sick. And I think that we'll probably generally use those same principles when the extreme social distancing that we're advocating for now hopefully is something that's lifted. What do you think, Dr. Duma?
I think unique for my patients is that many of them don't want to disclose the diagnosis of lung cancer to their employers. So what I have found that works is that we usually, this is not right now, because right now we don't know. Right now, most of my patients are home. But in the past, after they finish chemotherapy, we tend to generate a kind of genetic letter, and which gives enough information to the employer, but nothing to do with the diagnosis. So that can be something that patients can have and use as a support of their concerns. And if you don't feel comfortable saying, like, I have lung cancer, because that's your decision to share how much you want for your employer, but your physician or provider can provide you that letter that may open the conversation better than just going into your employer's door. So I have written a few in the last 3 days or so.
Yeah.
We also often write a letter just saying that someone undergoing therapy just needs flexibility as well. And that can also be helpful to show the employers.
Awesome. All right, here's one more question. I have adult children working in healthcare. I'm immunocompromised with cancer, being treated with immunotherapy. How do we handle seeing our family who are exposed routinely to the unknown exposure of COVID-19? Self-isolation and social distancing equals depression in already emotionally compromised cancer patients.
I think that's very difficult. So what we're trying to advocate, some of us, including Dr. Denduluri, in social media, is yes, social distancing, but emotional togetherness. I don't know if that's the right word, but that's the concept. So some of the things that we have recommended is to do frequent phone calls with family through video. So you can use WhatsApp, which is a free app that you can download on your phone. If you're not very techy, because one of my patients may not be, you can do it through Facebook too. So Facebook has a chat in which you can have communicated, because seeing your loved one is so important. I think phone calls are great, but I think the video has something that adds to the conversation. Some of my patients are having daily phone calls with their kids in which they have a time. So at 7 p.m. or after dinner, we talk. In the way, because otherwise you get involved in the anxiety and looking at the news and looking at your email, and then you may forget to connect. And yes, depression is so common, particularly with social distancing. So that's one of the things. Another thing is a lot of hospitals are running support groups online. So you can search to see if your hospital is running the support group online. Dr. Denduluri?
What I was going to say is, for those that don't have the means to have smartphones that have apps or FaceTime or Skype, I think it's important that adult children remember to pick up this old-fashioned phone and call. For example, there's a 90-year-old neighbor in our neighborhood that does not have a routine smartphone, and therefore her child is in Brazil, and she's being treated for a malignancy, and they're using the old-fashioned way of calling her. And I think that, fortunately, they still sell things like phone cards and things like that. That's all I have to add, is exactly what Dr. Duma said, is to try to connect in any way we can remotely. And some of my patients have said that even though it's not urgent instant gratification, so to speak, that they're receiving notes, especially those that are confined to the nursing home, they're receiving notes from loved ones. So I think the old-fashioned postal mail, which is still running, and also, I was joking with Tia earlier. I don't know how many of Dr. Duma's generation and others and Tia have seen the old-fashioned phones, but I think that's important to use too.
Yeah.
And I think writing notes is you value them more. I think that's something that I value more a handwritten note than an email. So
especially in 2020, right?
Yeah.
Where we're so used to just firing off that email.
Yeah.
Or text.
And here's the last question. I finished treatment 3 months ago, and I'm due for my 3-month checkup. I have anxiety because it's been three months since my last checkup. Should I go to the doctor for my 3-month checkup, or should I postpone it?
As Dr. Duma said earlier, I think it's a really personalized conversation between you and your physician and team, and that's really important to connect with them and say, hey, can I put this off for 4 to 6 weeks, or do you need me to come in? Because we don't know the exact circumstances of what that 3-month visit was for.
And you can do a telehealth visit. You can postpone the scans and do a telehealth visit. I think a lot of patients wait for appointments to ask questions. So, sometimes you may feel like, oh, I was ready to ask this, and then things are postponed. So sometimes just having that quick visit may help alleviate some of those questions that you may have. And we're all here for a team. And I want to ensure patients that you're not bothering your doctor. We are busy, but we are here for you. And everything we do is to make sure our patients are safe. For us, it's so difficult to see our clinics empty, but you won't bother us. We prefer that you call us, and we're here for you.
Thank you.
Yeah,
thank
absolutely.
you.
When in doubt,
go ahead. Oh, sorry. Go ahead.
No. When in doubt, just ask. And every time I call one of my patients to stay home, I tell them it's not because we don't want to see you. Like Dr. Duma said, it's heartbreaking to see the clinic so empty. It's just that we want you to be safe.
Yeah. Thank you. Well, that was the last question that was submitted to me, so I want to thank you so much for your time. And what I want to do now is we have a few minutes. I want to go ahead and open up the lines if anyone else has any questions that we did not ask. So to unmute your line, you press *6 on your phone, and then this way, if you have a question, we can get your question asked and answered. So I'll give us a few more minutes to see if anyone else has any questions. Or feel free to post your question in the chat, and we'll ask that question and get it answered. Just giving some time.
Somebody's typing.
Okay. Okay. I don't see anything at the present moment, but I think, so we'll go ahead and close the call. But like I said, I just want to thank you so much for your time. I know the two of you are extremely busy with everything that's going on. I'm sure your phones are completely ringing off the hook. So I just want to say thank you so much for taking the time out tonight to have this moment with us. Hopefully that this, for those that are on the call, I hope that this actually helped to ease a little bit of your concerns. And that you got a chance to get the answers that you may have had regarding your diagnosis, regarding your treatment, or if you have finished treatment, just your overall concerns of being a cancer survivor, being a cancer patient, and this new virus that has arisen. I am going to post in the chat. We do have a feedback survey that we'd like for you all to complete. If you can click on that link and fill out the survey. We'd like to get your feedback. This is one of first of many sessions that we want to do, and we want to actually, like I said, get your feedback so that we can be able to do more of these. Did you all have any parting words?
Thank you both for organizing this, and thanks to all that joined. We really, really appreciate how you guys are advocates for your health. And please stay home if you can, but like Dr. Duma said, emotionally connect with others however way that you can.
I want to thank all of you for organizing this. This is really important, and we will be apart now so we can be together later.
Awesome. Thank you so much. Julia, do you have anything you want to add? She may be on mute.
Mm-hmm.
I think she's on mute.
Mm-hmm.
Okay. Well, we want to thank everyone for their time. We will post the recording on our social sites, GRASS site as well as My Style Matters site. We'll have it on our social media pages as well. So, again, thank you, Dr. Duma, and thank you so much, Dr. Denduluri. And, you all stay healthy, stay safe, because we need you. And same thing for everyone else who's on the call. We thank you so much. And again, stay home, stay safe. If you have to go out, make sure you're washing your hands. Really good, singing the birthday song. Matter of fact, someone came out with, I think it was like 20 different songs that you can sing. So we'll actually post that as well, just to have a little bit of fun. But again, we really want everybody to stay safe. So you all have a great night, and thank you again for taking the time out to have this live Q&A session. Good night.